And along comes the 16th day with the 15th case of novel coronavirus here in the Bahamas. This as the global count stands at well over 870,000. The deaths beyond 43,000. Good morning, everyone. I'm Akush Lapinder, and this is your morning edition. The latest developments regarding COVID-19 and the action plan being taken by the government to be revealed as Prime Minister, the Most Honorable Dr. Hubert Minnis, is set to address the nation this afternoon at 4. That address will be carried live on the ZNS network. Meantime, the Bahamas turning the corner with an upswing in COVID-19 cases. The numbers climbed in the past several hours to 15. The latest patient, a 57-year-old female out of Grand Bahama who remains hospitalized in stable condition. Now, the woman has no travel history and no known direct link to the previous cases. This brings the confirmed cases in Grand Bahama to 3 and 12 in New Providence. Also, a patient described as case number 12 is now hospitalized and is receiving supportive management. All previous cases remain in stable condition and are in isolation at this time. But Minister of Health Dr. Dwayne Sands says we are on the brink of an uphill climb in COVID-19 cases.
The surge has started in the Bahamas, and we would like to do everything that we can to minimize the number of people infected, the number of people hospitalized, and the number of people that die. Every person in the Commonwealth of the Bahamas, from the north to the south, from the east to the west, needs to be aware of the possibility of COVID. We have confirmed community transmission in the Bahamas. Everybody needs to pay attention to the principles of hand washing, social distancing, isolation, and if you have any respiratory symptoms at all, fever, cough, call the COVID hotline, because the symptoms can be very subtle.
200 people still in quarantine. Dr. Sands also made it clear that so far there are no recovered COVID-19 patients in the Bahamas.
People have asked the question about there's no recovered patient on the list. The definition of recovered requires a series of negative COVID tests done over a period of time. That is what we have agreed will be the definition of a recovered patient. So even though patient number 1 is recovering, and according to lay parlance or lay talk, they may be recovered, when we report to our international public health agencies, we need to make sure that our definition of recovered is in line with the international definitions. When that happens, and we've gotten the series of negative molecular RT-PCR COVID tests, we will be pleased to report that patient and subsequent others as recovered. Because what we'd like to see is that the person is no longer shedding virus and no longer contagious.